I just want to make this short video. The incident that I occurred while I was at OSU hospital on Wednesday. I went into the hospital around like 5:30 a.m. for a surgical procedure for them to install a IUD. Because they couldn't do it in the clinical office, so they had to do it surgically. Um, so around like 7:30, I end up going back there, and they put me on the table to proceed with my surgery, and they gave me like an oxygen mask to put over my face, you know. So after my surgery, um, I was coughing a lot and everything else, but I was unable to open my eyes or whatever, and I was spitting up mucus and stuff like that, and I was having trouble breathing, and the nurse, instead of her trying to give me my asthma pump or whatever so I could breathe, I could hear her in the background getting frustrated with me because I was, blowing snot or mucus all over the place and stuff like that. And she wanted me to wait for a tissue. I could hear her. So then after I start coughing up, what I'm saying, I actually went unconscious. I wasn't able to move. I wasn't able to open my eyes or any of this matter. So, but I could hear everything that's going on in the background. So now the nurse, she's telling the other nurse, well, oh, now she's not responding to me and stuff like that, as if I was faking my not being able to be conscious, like I was just wanted to be rude, whatever. So I could hear them talk about, well, we're going to pinch her fingers and all this type of stuff that they did to try to get me to respond. And I still wasn't unable to respond to them. Then they end up getting me a Narcan to re-advise me. Soon they put the Narcan in my IV, then I woke up. I was able to, get up conscious. So now I see the nurse after I woke up, So they began to call my daughter to tell my daughter, well, your mom, she doesn't know your name, like if I was being delusional or whatever else. You know what I'm saying? So after I became, the anesthesia started to wear off and all this type of stuff. And so I get down to triage, you know, I get down to the second level, out of the surgery waiting room area because they kept me up there for an hour because they wanted to keep on my symptoms because my blood pressure was real high, my heart rate was real high, and all this stuff like that. But I could hear them in the background the whole time I was unconscious, talking trash, just literally just being kind of rude in the background. So when I went down to another level, I asked the girl, I said, I have had surgeries in the past, surgical procedure in the past, and I never experienced what I experienced today. When I woke up, my throat was so sore, and all down in my chest was very sore, and I was spitting up blood out of my mouth. You know what I'm saying? And she's like, oh, they had to put a tube down your throat and all this kind of stuff. But they had to put a tube down your throat. I said, well, when you're on anesthesia, they have to, you know, intubate you to have you on a machine or whatever else. So I was like, well, I've had like surgical procedure before where I have had anesthesia and I never had this reaction to it. You know what I'm saying? So at this point, I don't want them touching me anymore. I started crying, hysterical, and everything else because I really felt like, these people was trying to kill me at this hospital. So I go to my doctor's appointment yesterday, and so in the note, they never mentioned anything about them putting a tube down my throat. They never mentioned anything about intubating me, having me on a machine. So my doctor was like, okay, well, how do how long did they have you intubate? I said, well, I don't even know because no one said anything and no one could explain to me what was going on. She's like, and why would they have to give you a Narcan if they haven't gave you no narcotics or anything like that? I said that too. I do not know. Why did I have that bad reaction the way I did? You know what I'm saying? And why did they took them to give me a Narcan to re-advise me? You know what I'm saying? Because if you're claiming that you didn't give me, NARS or anything while I was in there, and I'm like, at this point, I don't even know what would have happened to why they had to put me on a breathing machine. When you had an oxygen mask when I went out, so in their notes, they don't have none of this in their notes or anything. So I want to just say this, for future reference for anybody, because I don't want somebody else to go through what I went through, because I went through a near-death experience at OSU Hospital. I was treated badly, because I was a black female. It made it felt like I was being rudely, that, I was faking what was going on with me. In reality, that it was inaccurate, what was going on with me. Instead of them taking the time to try to, get me to wake up or whatever else, so I'm advising any person, black or white, when you go into the surgery room, make sure you have someone who can advocate for you when you are going up under anesthesia, that can ask questions of what's going on and have them to tell you what's going on with your family member. Because a lot of time these people do stuff and they covered it up, just like they doing with my situation. Everything they're doing, they're covering up. They wrote in the notes saying that, my blood pressure was stable, which my blood pressure was not stable because it was very high. My heart rate was high. The one lady, Dina, she was lying, saying that when I came out of surgery, I had spoke to her. Well, if I'm unresponsive, how can I speak to you? So clearly that was a lie. Clearly there's nothing in the notes saying that they had to put a tube down my throat, or why they had to put a tube down my throat, or anything about me had to be on a breathing machine while doing surgery. None of that. They didn't even say how long they had me on there, or none of that. So I'm just telling you for future reference, I want to throw this out there to people. When you have family members that's going into these hospitals and stuff like that, please do call, check on them, call, ask questions, investigate, do all that you can do. Do not assume just because these people are doctors, they are nurses, or whatever, that they have the best interest of your family member. Because let me tell you something, doctors lie, nurses lie, people in the medical fields, they do lie and they do cover up a lot of stuff. So I'm just want to throw this out there because this is what happened to me and this is what I experienced. And once again, nothing that they can prove in my doctor's note, you know. So my doctor, she couldn't even know what to do because nothing in the note explains anything about me had to get a tube down my throat, me had to be intubated, or none of that. Nothing of that matter was listed in the note because they did not chart none of that in the note. Even in the note, they didn't really even chart that, they did chart a little bit about, me being unresponsive. They had to give me a Narcan to re-advise me. So if you didn't give me no medicine to overdose me, then why did you need to give me a Narcan to re-advise me? So that's just how quickly my life could have ended. So, and the fact that, they lied to my daughter, trying to make my daughter, unaware of what they was doing. So I'm just trying to tell you this. Please ask questions. Ask questions. Go with your family members in these surgery areas. Ask questions about the surgical procedure. Make sure you level out. And even before they was willing to do surgery on me, they wanted me to sign a form said if I had got COVID-19, because they was a high, you know, it was a high risk at the hospital of getting COVID-19. If I was to be exposed to COVID-19, that I would not be able to sue them. And I was like, well, if you know that you're a high risk facility as COVID, and you have me here as a patient, then there should be no way that I should be exposed, because you should do everything to keep me from being exposed. So why do I need to sign a document for you to do surgery on me, saying that I would not sue you if I was to get exposed to COVID? And I'm telling you, when you go in these hospitals, do not sign those papers, because you never know that they might intentionally try to give you COVID, and then it's nothing you can do about it. So I'm just telling you, people, just like have someone there when you go to ask questions and stuff like that. Because my experience, and I've been at this hospital before, and I've had surgical procedure at this hospital. I had a hip aspiration surgery there. I've had, three surgery where I had to go up under anesthesia, and I never experienced what I experienced, or almost life threatened, at what I experienced on Wednesday. So I just wanted to make this video. Some of you may say, well, I'm being over dramatic or whatever, but I'm just telling you my story, because this is what happened to me.